Hi, this is Dr. Robert Cywes, the Carbaddictiondoc, here with episode 2 in Understanding Diabetes. In this episode, we are going to look at the current status quo, the general principles that endocrinologists, family doctors, other doctors who traditionally treat diabetes do it, how they understand it, and what their principles of treatment are. But here's the key thing. Everything I'm going to talk about right now is absolutely wrong. It's absolutely incorrect. If you want to become diabetic, if you want to maintain your diabetes, if you want to get progressively sicker until you die of your diabetes, follow the guidelines of the American Diabetes Association, the American Endocrinology Association, the way diabetes is currently managed. I've never met an endocrinologist who ever put diabetes into remission using this methodology. We put people into remission every single day by a different understanding of the cause and the treatment of diabetes. But this episode is all about how it currently happens. So the first principle is that endocrinologists will tell you, we don't know why. We don't know why. We don't know why people get type 2 diabetes, get type 1 diabetes. It happens. And they love to say, oh, it's genetic, but there are no genes that do it. But someday we'll find out what the genetics are. We do know that type 1 diabetes is destruction of the cells that produce insulin, the islet cells in the pancreas. So yes, we do know the cause of type 1 diabetes. But other than that, we have no clue about how to manage diabetes if you listen to the ADA or the endocrinologist. Because their belief is that diabetes, once you have it, it's forever, you have it forever, and it is a chronically progressive disease that you had no role in doing to yourself. And what they do is more and more and more, they throw medications at you to try to slow down the progression of the inevitable. But eventually, they will tell you you're going to die of your diabetes. And the more stable you can keep your numbers, the better. Absolute garbage. But let me take you down that way of thinking, because if you believe that diabetes is a progressive, non-curable disease, then what you do is you monitor people. And the way they monitor diabetes is primarily based on something called hemoglobin A1C. So what they do is to diagnose diabetes, your A1C has to hit an arbitrary number of 6.5. Between 5.7 and 6.5, you're insulin resistant, and then above 6.5, you now have diabetes. Okay, whether it's type 1 or type 2, or gestational. And what they look at is how effectively you're able to clear sugar from your bloodstream and how much that chronic elevated sugar damages your red blood cells, which is what hemoglobin A1C is. A1C is where sugar attaches to the hemoglobin in your red blood cells, and it's a percentage of what percent of cells are damaged by that. The average lifespan of a red blood cell is 120 days, then it dies and it gets replaced. And if the replaced ones also get glycosylated with glucose, your A1C progressively goes up. And in order to get your A1C down, those red blood cells have to die off and be replaced. So that's how they manage this. And when your hemoglobin A1C is 6.4, oh, you're fine, you're pre-diabetic. You have insulin resistance. Okay? Your body doesn't understand that 6.5 is diabetes and 6.4 is normal. The same damage is happening based on blood sugar. In the previous episodes where I explained that damage, how sugar damages every blood vessel in your body, how it can cause clots to go off and cause strokes and heart attacks, how it collapses blood vessels and results in the death of all the organs in your body, damage and death to all those organs, which is what diabetes is. Which is what diabetes is. It affects the brain, the eyes, the heart, the lungs, the kidneys, the entire body, the limbs, especially the end limbs where the small blood vessels are. So the standard thinking of diabetes is, yes, to a certain extent, it is related to how you eat sugar. But the underlying incorrect, wrong principle that the endocrinologist and the diabetologist, the experts believe, is that you have to eat carbohydrates. And as long as the understanding is that carbohydrates, sugar and starch, the consumption of sugar and starch are vital to human survival, then your entire management strategy is based on that principle. And I can tell you categorically that the consumption of carbohydrates is unnecessary for human survival. They believe it's absolutely necessary that you have to eat carbohydrates because your brain needs sugar and your body needs sugar. And here's the problem. Here's where it's subtle. It's absolutely true. There are certain cells in your brain, certain cells in your blood vessels, certain cells that have to have sugar. That's true. That's correct. But here's what they don't understand, is that the human body is extremely proficient at producing sugar from amino acids and glycerol or fat. So the liver is your source of sugar. It doesn't have to come from your mouth. And when you put sugar in your mouth on a regular basis, over time that overwhelms your sugar regulation system, and that's where diabetes begins to happen. And yes, diabetes is a genetic disorder in that when you stress it with excess carbohydrates, there's a cap to how much insulin you can produce. And above that cap, that's where diabetes happens. So some people are high insulin producers, their cap is very high. Some people are low insulin producers, they become diabetic very easily. But no carbohydrates, no diabetes, except maybe type 1. So once you believe that you have to eat carbohydrates, the next principle is, okay, we know you have to eat a certain quantity of carbohydrates with every meal. Let's say it's 50 grams per meal. And because your blood sugar is doing this all day long, now you have to eat a snack as well. And we know that fat is really bad for you. Fat kills you. Fat causes damage to you. And if you're not on a statin as a diabetic, you're in all kinds of trouble. So they normally put their diabetics on a statin to prevent the body from healing itself, quite frankly, where sugar does the damage, but they believe that the fat is doing the damage, so they put you on a statin. So most diabetics are prescribed statins just for being diabetic or pre-diabetic. Then the next thing they do is they say, okay, you have to eat, let's say, 50 grams of sugar with every meal, and you have to have a few snacks a day. So you're eating 6 to 8 meals a day just to be able to manage your blood sugar, to keep it up. And then what they ask you to do is to check your blood sugar before a meal. And then they've got this mathematical formula. You know, I think about mathematical formulas in biology. They've got this mathematical formula by which they can calculate how much medication you need to remove the sugar you've just eaten out of your bloodstream. Okay? Think about that. They're checking what your level is. They're then going to increase that level, and they've calculated how much medication you need to remove what you've just put into your face out of your body. That's the way they do it. So what you do is you take your medication before a meal to account for the sugar you're about to eat. They don't treat your blood sugar. They treat what you put in your face. That's ridiculous. That's crazy. And a guy I did my Ph.D. with, he was on the committee of my Ph.D., a guy called David Jenkins, in 1981. We were struggling to understand diabetes. And in 1981, what David Jenkins published was something called the glycemic index. And the endocrinologists heavily have bonded to the glycemic index. What it means is, based upon what type of sugar and what form of sugar you eat, how long it takes the enzymes in your intestine to process and break down that sugar, the glycemic index determines at what rate the simple sugars enter your bloodstream after a carbohydrate meal. So let's say you eat a baked potato, which has got a bunch of starch in it. Your intestine has to slowly break those down, and it takes much longer, and it's a much slower way to release all that sugar into your bloodstream. And the glycemic index is an index of different food types based upon how quickly that sugar enters your bloodstream in a bolus, and therefore how high your blood sugar goes. So if I eat 3 teaspoons of cane sugar, that's very simple sugar, my blood sugar goes up very, very quickly. Or if I drink a Coke, which is pure fructose and sugar, it goes up tremendously. When I eat the baked potato, my glycemic index rises more slowly. So they use the glycemic index to quantify how much medication to give you to get that blood sugar down. But ultimately, the problem with the glycemic index is it doesn't matter whether it goes in slowly or fast, it's still that same amount of sugar that's entering your bloodstream. So to make it more sophisticated, they then went and looked at something called glycemic load. Irrespective of how quickly your blood sugar goes up, how much sugar is there in what you eat? So something like watermelon may have a very high glycemic index, but it's actually got a relatively low in the carbohydrate world, glycemic load, because there's not a huge amount of sugar in there. But it spikes your sugar, and then it comes down very quickly. And in a very sophisticated way, they figured out how to treat you with medications to get rid of that sugar from your bloodstream. But it doesn't mean that the sugar isn't doing this the whole day in your bloodstream, causing damage and damage and more damage and more damage. And then the medication doesn't work that well, so you need more medication. Ludicrous concept, both glycemic index and glycemic load. But they've become very sophisticated. You go to the American Diabetes Association website, and the last time I looked, there were 99 different forms of medication to treat diabetes. 99 medications to help you to get rid of sugar from your bloodstream. 99 medications to help you to take care of what you put in your face. Bizarre. And you know what the one thing they don't tell you is that if you don't eat carbohydrates, you cannot be diabetic. Only now are they starting to say that a lower carbohydrate diet will help you a little bit. But diabetes is still forever. That's the misnomer. I know differently because we put diabetes into remission every single day in my practice. Actually, we don't. We help our patients to do it for themselves. But the key thing now, at the end of this talk, let's talk about some of the medications. The medications are divided into different classes. The first most obvious one are various forms of insulin. And you can get a short-acting insulin, you can get an immediate-acting insulin, and a long-acting insulin. And these are typically what we inject into our bodies as insulin to rapidly or slowly remove sugar from our bloodstream. And they've got various names, they're produced by different companies, but those are the three categories. And then you've got some combinations, a 30-70, combinations of short and long-acting insulins. And they've got all these formulas and all these calculations that tell you how much, sliding scales and pre-dosing based on how much carbohydrate you eat. That's how we manage blood sugar with insulins. And that directly causes the tissues to take up that sugar. The problem is, what they don't account for is the fact that your tissues become resistant to that insulin. And then you need more and more insulin to have the same effect. They calculate your insulin dose based on normal. And then they've got tables for progressive insulin resistance. And the problem is eventually, whether you're a type 1 or type 2 or a gestational, you can eventually reach a point where your body no longer responds to insulin. Where your body no longer responds to insulin. It's so insulin resistant, it no longer responds. And ultimately, that's the ultimate step before death. Before ketoacidosis and death. And that's an awful state to be in. Now, the other medications, metformin, which is actually a medication I like, increases insulin sensitivity. So when you take metformin, it allows your body to be more receptive to the insulin you are producing and are giving yourself. And I like metformin as a drug early on in the transformation from insulin resistance back to insulin sensitivity. On the other side, they've got other medications that whip your pancreas to release more insulin. So they force more insulin production from your body. And then there's this whole complex system of medications that help you to pee out more sugar. So you put it all in your face and it's not reabsorbed from your urine, so you pee it all out, the Victosas and that kind of thing. Some of them are injectable, some of them are oral medications. But they work on your body eliminating the sugar in your urine. Well, that's not what you want. You don't want to pee sugar. So they're either increasing your body's ability to store it, but they're trying to manipulate what you put in your face. If you step back from that and you change what you put in your face, then surely you don't have to treat what you put in your face. But the principles of current endocrine standards, the gold standards, the guidelines, are to treat a diabetic based on carbohydrate consumption and dose insulin to what they eat and drink, not to their blood sugar. And therefore, the majority of endocrinologists don't see the value of continuous glucose monitoring, of knowing exactly what your blood sugar is all the time. More and more patients are trying to convince their doctors that they want to know. But most endocrinologists will tell you to check your blood sugar before a meal 2 or 3 times a day. How the hell can you manage something that's continuous in your bloodstream once or twice a day? And here's the statistic from my practice. Less than 25% of my type 2 diabetics ever check their blood sugars. So they're popping all these diabetic medication, and thank God they're eating all this carbohydrate, otherwise their blood sugars would go low. But they have no clue what they're doing. And then they're surprised when their feet fall off, or they go blind, or their kidneys start failing. This is probably the single worst managed disease in the United States of America right now and in the world right now. Because it's based on one failed premise, one erroneous premise, and that is that the human body has to have sugar. If you make one change and you understand that the human body does not require the consumption of carbohydrates, your entire perspective of diabetes management changes. And ultimately, if I can convince endocrinologists, family doctors, any doctor that treats diabetics to make that one simple mindset change, that's what we're looking for. Change away from understanding you have to eat sugar to the fact that it's not necessary and it's a bad idea for diabetics to consume carbohydrates. And then your paradigm shift will help you to treat diabetes to remission. More in the next episode.